Welcome to this webinar on cues, what it does and how it works. Today we will be discussing these 5 issues as they relate to cues. Cues, what is it? Well, it is EFM pattern recognition software. As you can see in the panel on the right, it identifies baseline, accelerations marked with green upward pointing triangles, decelerations marked with brown downward pointing triangles, and contractions. It has been evaluated in terms of its accuracy by a panel of experts with the NICHD. They examined their levels of agreement with cues in over 100 tracings and reported their results in kappa scores of 0.82 to 1, which represent very high levels of agreement. But cues does much more than simply analyze a tracing. While that is fundamental, it takes that information and provides it in very useful ways to clinicians. Here at the top you can see 30 minutes of tracings with the cues markings. Below that is a 4-hour trend. There is a slider window which always corresponds to the portion of tracing in the top panel. You can move it to select any 30-minute windows to show in the top panel, and so you always can see your current tracing and the context with respect to the surrounding tracing. The bar under the 4-hour view reflects EFM status. Orange shows where the compressed tracing has met or exceeded certain criteria or triggers set by your institution. The calculations under the window summarize the tracing for that 30 minutes. Finally, you may choose to export these measurements to your EMR, and you can edit or select some of the tracings or all of the markings to export. So now that we have introduced what cues can do, let us examine some real experience. Here we have a panel with a red portion in the 4-hour view. This red portion reflects a portion of the tracing that has exceeded the HCA oxytocin checklist criteria. And the criteria that has been exceeded are contractions, and you can see that in bold and caps underneath in the summary of the analysis for that window. Here are the HCA oxytocin checklist criteria, but you may choose any combination of these or any other factor as long as it's one of the factors that we measure on the tracing. Finally, the markings that appeared while you're taking care of the patient will not be retained in the tracing. Now that we've introduced what cues can do, let us examine a real experience associated with its use. This is a large multi-facility study in mothers at term with a singleton baby. These institutions have a very active and a multidisciplinary perinatal safety program. During the decade of this study, in which there were over 78,000 births, you can see rising rates of maternal complexity. BMI greater than 40 in green, hypertension in blue, diabetes in red, all rose during this decade. The next panel shows some outcomes. The blue columns represent cesarean section rates, and you can see that they were rising until PeriGen's modules were introduced around 2011, and then they stabilized. The rate of babies requiring CPR or ventilation at birth in red fell steadily over the decade, and the rates of babies requiring transfer to the NICU in green rose between 2006 and 2012, and then reversed directions and fell. In fact, over the course of this study, babies requiring CPR, intubation, or ventilation or transferred to the NICU fell by over 50% from their highest levels during that study. How does cues actually work? Well, there are 2 fundamental techniques. We use digital signal processing techniques to analyze the tracing. We find with these techniques regions that are flat. We find bumps, which could be potentially accels or decels, and measure various features of them. Neural networks are the technique that we use to determine whether that segment of tracing is actually an X cell or a specific type of D cell or a baseline. Neural networks are useful in situations where there is variation in the appearance of a subject of interest. Because there are many exceptions to rules, neural networks can handle these biological variations, and they're very prevalent today, used for medical imaging, face recognition, and voice recognition, and we use it for the pattern recognition in cues. Let me show you how it works. It is a recursive method. We first look for potential baselines. You can see them marked here in the upper panel, and then eliminate using the neural network the most unlikely ones, retaining only the more likely ones. We do a similar process for accelerations, finding all possible accelerations, refining that to include only the more likely ones, and the same thing for decelerations. When decelerations are detected that have a gradual onset, we then look to see their relationship to contractions to determine whether or not they are early or late. And this process is repeated until we arrive at a high level of confidence. Then patterns are merged, event boundaries are refined, and the final results are posted. Only final results are actually ever visible to the user. When does it work? It works at gestational ages of 36 weeks and beyond, and it's now available for multiple births. Why is it useful? We know that there is inconsistency in human interpretation. Despite countless hours spent in training, inconsistency remains a major issue. When we look at babies born with birth-related injury, delayed recognition and intervention remain a problem. Not much has changed in that over the past several decades. And the fundamental questions that are often debated, particularly in courts of law, is how long is too long for a particular type of pattern? We know that outcome is related to the degree of abnormality, the duration of that abnormality, and trends. Is that persistent? Is it getting worse? And that's why this sort of analysis, and in particular the displays and the color coding, are designed to help clinicians determine what is the degree of abnormality, how long has it lasted, and what are the trends. In closing, there are two other issues that I'd like to address. One is, will this system lower my team's perceived value? Because this is a very common question that we get. Well, this arrow represents the general sequence of steps when using a monitoring device in clinical care. On the left, the most basic step is to obtain, in our case, fetal heart rate and uterine pressure signals. The next step is to look at it, to measure it. The next step is to interpret. What does it mean? What do we think is happening to the baby? What do we think is causing it? What is the baby's response? And the next step is to project. What will happen if this pattern persists? How long will be the labor? How long will my baby tolerate this? And finally, of course, what should I do? And it's only the final step, of course, that actually affects outcome directly, but it is dependent upon all of the other steps. So, in answer to the question, will this system lower my team's perceived value in this process? Well, I think there are two parts, and it depends on what you consider the main task of your team. So yes, if the main task of the clinical team is to measure and record, then cues will assist and make that less onerous, more efficient. However, if the main task of the team is to understand, project, and act, cues will not lower your team's perceived value. In fact, this is the highest value of a clinical team. Thank you very much for being with us today. For more information, please email us at the address shown above. Good day.